Hi, Camille Roby coming to you again from Adult Health 1, Professor Lukowski's class in Section 1, Term 2. So in addition to my primary IV administration video or segment, I would have also, when first introducing the medication of vancomycin to my patient, because this is his first time ever receiving this type of medication, I would go ahead and not only let him know and inform him of the actual dose to be administered to him, but I would also give him a little bit of background information in concern with this medication. So I have a little background information here about vancomycin. And it's, for one thing, the drug type is an anti-infective. So what I would have done to prepare this actual medication is with the normal saline, and it would be running, as I said earlier, on the primary. But it's an anti-infective, and so the treatment that it usually does or initiates the treatment of potentially fatal infections. And it also has a bactericidal action or effect to it. Some of the contraindications would include a hypersensitivity, and even the side effects. The side effects are very severe, so I would have informed Mr. Jones that there's a potential to develop ototoxicity, so that would initiate further labs, such as to test his cranial nerve number 8 for his hearing. Another severe side effect that this drug can produce is nephrotoxicity. So some of the tests would be to check his blood and creatinine levels, and also he could possibly experience some nausea and vomiting, some hypotension, and he would also it's a high chance to develop a rash, specifically known as red man syndrome or redneck syndrome. So those are some things that he would have to know and possibly to expect to occur. As I also mentioned too, in dealing with the dose, I would have let him know that amount, 0.5, and I would also have let him know, or personally I would have assessed this patient, Mr. Jones, for any signs of previous anaphylaxis or even anaphylaxis after administering this medication, because once, like I said, this is his first time taking it, so we want to be very sure that he does not develop any of these signs, and that if it does, then we would take further actions. We would also, I would also go ahead and have the culture and sensitivity test performed before even receiving this medication, because that is standard hospital protocol, is to have a culture and sensitivity lab put in way before he even is administered this antibiotic. Another thing I would also watch for is any super infections to develop. And lastly, in dealing with this medication, because there's a possibility of him developing that rash, the red man syndrome or redneck syndrome, I would have to monitor how fast that rate is going. I may have to slow it down, because that is one sure way for him to develop this rash, is because if it's too fast of an infusion, then he could develop that syndrome. And so I would just slow the rate down or possibly dilute it if need be. All right, thank you.